Six, we will secure adequate supply of H1N1 vaccine for our people. Besides our existing supply contract with the vaccine manufacturer, we are also in active negotiation with other vaccine manufacturers. The objective is to diversify our supply of H1N1 vaccines because the vaccines produced by each one of them are not exactly identical. An important consideration will be which manufacturer can promise the best delivery timeline. But these are new vaccines, so they are still subject to clinical trials to ensure safety and effectiveness. So I think we should be realistic about the timeline for availability of a safe-to-use vaccine. Seven, our scientific committee, which is chaired by DMS, is actively evaluating the characteristics and the genome of the virus. The good news is that the virus here remains identical with the virus in North America. You may remember there was an earlier press report about some Brazilian claim that the virus there has mutated and was no longer the same as the North American virus. But I think the report has since been found to be flawed. So the consensus view is that the virus remains moderate risk as described by WHO. Singaporeans therefore really do not need to panic over this development that there is now community spread in Singapore. Almost all infected cases will be able to recover fully. Tamiflu and Relenza remains effective against this disease. But I thought I should explain that moderate risk does not mean no death. Just like the seasonal flu, there will be some deaths. The data from North America suggested a case fatality of 0.37%. What this means is that out of 1,000 cases, one should expect a few deaths. And in North America, the number of deaths has already exceeded 100. And in Australia, they have already reported their first death. And that's why we need to target the high-risk patients, especially those with underlying medical conditions, and to render them the best chance of a full recovery. And that's why we need to allow our hospitals to be able to focus on the high-risk cases and not be distracted or overwhelmed by hundreds of mild cases.